Well, good morning, everyone. In the next 20 minutes, we hope to get 3 points across. Number one, that patients as consumers. Number two, the power of collaboration and strategic partnership. And number three, why I think we're here at this conference, is the need for innovation. As Vic mentioned, I've been over 20 years in healthcare operations in the hospital. And my job was to manage a cost-effective operation and build the best workplace possible for physicians to practice medicine and deliver care to their patients. Frankly, the physicians were our main customers. Patient voice didn't even come into play until the HCAHPS programs. And when we think about the physician practice side of the equation, modern healthcare started out very high touch. There's probably a few of you that might remember a house call or a direct payment to your physician. And then entered the third party, commercial insurance and Medicare. And for us operators, that was restriction and oversight and complex processes for reimbursement rules that really created a fee-for-service treadmill that we got on. And frankly, for us operators, it distracted us a little bit from the focus that should have been on the patient and their illness. The industry view truly became, the doctor will see you now. For the past 5 years that I've been in Nashville anyway, I've heard this. Healthcare is broken. I've said it. I think you've heard other hospital operators say it. Economists, analysts, pundits. Costs are unsustainable, and where's the value for the patient? But I'm going to suggest, a bit boldly, to my peers that I think we need to quit saying that. Hospital executives, physicians are sitting down together at the table, and the conversation has shifted. There's been progress in all verticals of our industry. And so let's celebrate the scientists for a minute. They've pressed on. Each year we continue to set new records in life expectancy and declining infant mortality. And since 2005, 8 of the 10 leading causes of death have declined. So why the change now? And most of you know this, it's because costs are unsustainable. And with the ACA, new reimbursement models were introduced to hospitals and physicians to manage cost. And on the employer side, benefit plans were redesigned, which increased out-of-pocket costs for patients and high deductibles to manage costs. And those two forces combined really made us know and understand the need for innovation. We had to understand what drove value from the patient's perspective. Fortunately, though, the ACA also gave us some other opportunities to innovate and collaborate with our physician partners that, frankly, we were never allowed to do before because of legal impediments. Through our accountable care organization, Mission Point Health, we can do things like clinically integrate and talk about taking risk so that we can look at the care of the patient over their lifespan, population health management across care streams, and we can focus on the patient and not necessarily on that one patient interaction while not worrying in that narrow focus, who's going to pay for it? Primary care physician is your regular doctor, right? The relationship between patient and doctor is sacred. My doctor told me to. I trust them. There's a bond. That's what we always thought. And patients proved it because they put up with long wait times in the waiting room, limited access and availability. It's okay, I'll wait on him. And so we were a little surprised when a recent survey showed us that only 53% of patients say that they're highly likely to stay with their primary care physician now. And we've known that unlikely competitors are solving for access and convenience. And yet we were still shocked because our mentality has always been, if we build it, they will come. Big box facilities, right, that required patient travel to us. We literally expected that patients would travel to us. And we're thinking differently now. There's been a radical shift. Our plan now is frankly to build a system of care where we provide services and access to patients in their neighborhood or in their home. This, if you build it, they will come, is being replaced by we will come to you. We might come to you via your smartphone, your home computer, or a specialty clinic in your neighborhood. And this is where the innovation is going on. This is the radical shift in the conversation, because we still have all those complex, non-standardized processes out there that we have to contend with. Hospitals, executives, their physicians are coming together as health systems, and they're really, truly understanding that we need to know our patients as a person, not the clinical diagnosis, and we need to really listen to what they're telling us about what they need and what they want and what they value in their healthcare experience. So it's a big jump for us, and that's why we need you. Strategic partnerships are so vital. We need to work with industries that have been treating our patient population as true consumers. We need to understand how to leverage technology to reach out and interface with the patients where they are and still meet the challenges of the day-to-day. But good news, fortunately, we recognize this in healthcare, and we know we can't employ every physician. We can't own every access point. We need to enlist the help of others, and we need to collaborate. So Colton is the CEO of FoxFuel Creative. He works with us on our digital presence, and every once in a while finds a really interesting, innovative partner for us to work with. Colton?
Dawn, thank you very much for that kind setup and introduction. Over the past year, I've gotten to work very closely with Dawn, and I've been able to see firsthand as she made this transition from operator over to innovator. And what's interesting is that since she's now charged with improving every patient interaction, she no longer has to focus solely on just improving operational efficiency. What this means is that she's able to take time to investigate innovative, creative ideas that are going to engage patients. Historically, even the language of healthcare has really centered around this concept of isolated patient interactions, right? So we say that a patient presented with X, Y, and Z factors, and then we record what's prescribed, and then they go away for a while until they come back up again for a checkup in one of our facilities. That entire process kind of assumes this model where we get to see snapshots of the patient over time in these very static states. By and large, the healthcare industry has kind of ignored the fact that most of its products carry a decision cycle just like that of any other product out there on the market. So if you're a patient that's considering bariatric surgery or knee replacement or even a simple cancer screening, all of these still carry a decision cycle that is potentially a life-altering event. So that patient still has to go through need recognition, research, exploration of alternatives, etc. Right now, what healthcare systems are trying to do is find and fund innovation that helps them engage with patients in the middle of that decision cycle. I'm going to take just a minute and I'm going to brag on St. Thomas for 2 areas that we can highlight where they're doing this directly by investing in creative, innovative startups that are helping them adapt to the way that healthcare has changed. The other reason why I'm going to talk about these 2 technologies is in an interesting way they bookend what we have traditionally considered to be the overall patient experience. Clariture has been a great partner for St. Thomas because they help them rethink how early you can engage a patient in the process, potentially even before that patient has realized that they have a need for care. Their platform uses powerful data to target at-risk consumers across search, social, and mobile channels. How does this work? They use predictive modeling and behavioral data to send the right message to the right person. They then measure that engagement against patient acquisition ROI. Practically, how does this play out? You take a 45-year-old female who's a sufferer of knee pain and a frequent purchaser of OTC pain meds and anti-inflammatories. You then compare that person to past patient profiles, and then you do that based on their online behavioral data. You can then plot them at a very specific point in their decision cycle, and you can send them a customized, tailored message across Facebook ads or online search or a number of different social mechanisms. After that, you can then measure. How's that engagement going? We can do that across online assessments or online appointment requests or a number of different online seminars and things like that. Later on, what that lets you do is you can follow up and you can see where they show up as a billed patient downstream. As healthcare systems look to improve their care and as they want to approach consumers before they know they need that care, it means stepping outside of the traditional walls of your facilities, and it means engaging patients in the platforms where they're already present. Hum was another example of innovation that's been pulled from other industries. So many of you may know that immediate feedback loops are a big problem for health systems, right? Because they're expensive, they take a long time to process, and it can be very difficult to track a specific piece of feedback all the way to a provider or a particular care path. Hum was actually operating over in the restaurant space when some smart folks from Yale got together with them and showed them the practical application inside healthcare. So now, St. Thomas is actually running a pilot in a few different areas where a patient, upon checkout, can take 45 seconds and they can fill out a number of questions on one of these geofence tablets that kicks over all this data into an online dashboard. Previously, we were able to capture maybe 2 to 3% of feedback from patients, and there was a delay there. Now, in the facilities where it's deployed on those floors, we can capture 80 to 90% of that patient feedback. What's great is that for those online dashboards that people can look at in real time, the head nurse or the administrator over an entire floor can look and see what the patient experience has been like that day, that hour, or in the last 15 minutes. What that means is that they can then spot maybe there's an overworked nurse who needs to take an early lunch break, or maybe you have a bathroom facility that needs some attention because it's weighing down some of your cleanliness scores. There's a number of different things that you can imagine how these factors allow us to engage with a patient in the middle of that process and then adapt exactly what we're doing in order to improve their overall patient experience. A really great thing happened the other day. We were working with Fahad Tahir. He's the CEO of St. Thomas's Employed Physician Practice, and we're developing the new website that'll roll out in a few months. And in one of our meetings, I was giving pushback to Fahad, saying that I wasn't comfortable adding functionality and language to this website because when a patient showed up at a facility, we couldn't deliver on that promise. They didn't have the operations in place at present. And Fahad said, let the website press us to create the process to deliver care. I thought this was great because this is a healthcare operator saying, hey, I know we have some complicated systems, but we're just going to make the patient work their way through our process, that way they can get care. That was not his approach. His approach was, if a consumer is hitting a website that's supposed to be tailored to them and it's supposed to be about them, what is their expectation? What is their expectation for experience? And then how can we internally change our process and our operations to match that need? That's where a lot of the innovation right now that's needed. It's around how can we actively disrupt what we typically consider to be the interaction between a patient and their provider. Over at FoxFuel, we are fortunate enough this year to have a concierge physician that treats all of our employees. The other morning, I woke up with a sore throat and I texted with my physician. I then took a selfie of my throat. I answered 2 or 3 different questions, and there was a script waiting for me at my pharmacy on my way into work, all before I got out of bed. That is a healthcare encounter that once you've had it, I can't go back to the old way that I used to interact with my provider. And what's really exciting is that those systems, platforms, and processes that we used, they weren't terribly complicated, but what we need is we need that ability and the pathway to bring all of those technologies to scale for widespread adoption. So, let's talk about that for a quick second. At this point, it makes sense to explain the relationship between Ascension Health and St. Thomas Health. You take an organization like Ascension that has 114 different health systems, and you can then understand that they have the time, energy, and resources to invest in very specific, small, low-risk startups that are going to deploy within just certain rooms within a facility or just across a couple floors. And then as they see success over a 60, 90-day pilot, they already have the infrastructure in place, and now they're creating these pathways where they can rapidly begin to deploy across multiple floors in a facility or across entire hospitals or systems or regions. What I love about Nashville is there are 3 such national companies that love doing this, and they are actively trying to build out those paths so that way they can adopt innovation that much faster. So, when Dawn and I were talking about this presentation, I said, Dawn, if we're going to talk about creative innovation and we're going to talk about the need for strategic partnerships, what if we made it very practical for everybody out here in the audience today? What if we were open and vulnerable and we talked about a few of the things that we've been working on that we don't have solutions for yet, things that Dawn really wants to address? So I realized that this is the equivalent of throwing Dawn to the wolves, but we're going to talk about some of the things that we're actively trying to do. And if you have a solution to this problem, you can come up, force a card into our hands, and start a conversation. So with that being said, Dawn, do you want to close us out by talking about 1 or 2 things you're working on?
Sure, I'd love to. Thanks. So the first thing I did, because the challenge of any new innovation in our workspace is the workflow. How are we going to do it? How are we going to do it well? How are we going to change? And so operations gets very paralyzed when introducing these new ideas. So how do we craft the pilots so that we can make them successful? So I went to, close to my heart has been, frankly, this whole billing thing. Okay, so I went to my Vice President of Revenue Cycle, Nola Wyatt, and I went to my Chief Informatics Officer, Mike Mover, and I said, we got to fix billing. Because I would love to see, by a show of hands, the person that has never had a complaint about their bill or a question about their bill or an understanding of their bill. Is there a person like that in the audience? Right, so there's my focus group. All right, so we have a problem to solve. And it's not easy because we don't have the technical magic to make that unique patient identifier across all the different electronic medical records that happen. And so how do we make it easy for our true customer, right, the patient? How many of you have had a surgical encounter? You get a facility bill, a surgical bill, I see the heads nodding, an anesthesia bill, maybe a pathology bill, for one morning in surgery, and you have a high deductible. Who do I pay? How much do I pay? And what's my explanation of benefits telling me to do? So we really want to solve for this, and we'd love to have your feedback on that. The second problem, a little bit along the same lines, in talking with Nola and Mike, I have to start it with a confession. We still photocopy insurance cards. Every year, we ask you for it, and we walk over to the photocopier and make a copy, and it goes off into a file, never to be looked at again. So Nola and I have this dream that as a patient presents, thank you for losing our language, as the patient presents, we have this ability to see these estimated charges, and it's real time connected to the payer that tells us that they have coverage and at what level and what it might cost them out of pocket. And we wrap all that technical magic together and say, here's this just for you, and you can pay it through PayPal if you want. And we never kill another tree. So to wrap it up, that's our 2 problems we'd really love to solve quickly. So just, from here, where do we go? We know we need strategic partnerships. The power of innovation in this room is amazing. We need to understand our patients so much better. We need to know them as a person. We need to understand what they want and expect and what they feel about their healthcare experience so we can deliver the right care at the right place, at the right time, and at the right cost. So thank you for your time and attention.